Welcome back. This is Dr. Kaan of the ACL Academy, and today I'm going to touch on common mistakes to avoid during your ACL recovery process. Before I jump straight into it, if you guys have been following along, found some value out of this channel, please subscribe to it. Please like the video. If you have questions or comments as you go along, please drop them below. We get to every single one. So, some common mistakes, common pitfalls during your ACL recovery process to avoid. I'm going to go over the top ones and some solutions for you. First and foremost, number one, people rushing into surgery. We do not want to rush into surgery after your ACL injury. You want to take some time, not only to get a proper diagnosis and to find the experts for our care, but also to do what we call prehab or rehab the knee to prepare it for surgery. We know that there's some good evidence and data suggests that the better the knee looks going into surgery, the smoother the outcome of the post-operative recovery process. So sometimes people think like, oh, well, I just got an injury, let me get it fixed so I can get started right away. And it's just not the case. After your injury, you're going to have pain, you're going to have swelling, you're going to have stiffness, and the muscles are going to get weak. It's important that we get rid of pain and swelling, that we restore your range of motion, get the stiffness out, as well as get you as strong as possible going into surgery. Number two, not using an expert for your ACL recovery process. That includes a top surgeon as well as a top rehab specialist. So it's very, very important on the surgery side that you get a few different consults from a few different surgeons that not only have experience in orthopedic care, but specifically in the niche of ACL surgery itself. So that's what I would recommend. In order to find a good surgeon, you can start with some friends and family who've had ACL recovery and been through this process. If you're a part of a team, you can ask some teammates. If you know any local physical therapists or athletic trainers in your area, this is also a good resource to ask because they see a lot of these injuries and they may know the go-to doctors in your area. Once you find two or three of them, have a consult with each and speak with them, come with questions, and then pick your surgeon based on that. Number two, finding the right rehab specialist. So just like you're picking a surgeon, you're not going to just pick any rehab person just to do your physical therapy or rehab, because this is the long part of the process. Surgery is only the first step, and this recovery process can take 9 months to a year, sometimes even longer. So it's very, very important that you get somebody on your team that specializes in ACL injuries. A lot of times people make the mistake that they look into their insurance plan or they look at where they're located and they see who's the nearest person there. They end up at a clinic where they may not see, too many ACL injuries. They may see one or two ACL injuries per year. And we really don't want to follow suit with that. We want to find a PT, a physio, a rehab specialist that sees a lot of ACL injuries, that is very experienced in ACL care, that can guide our process. So important, especially if we're somebody trying to get back to a cutting, pivoting type sport. Third mistake, not being consistent with your recovery. As I said before, it's a long rehab process. There's some ups and downs. And it can be draining at times. And unless we're a professional athlete or collegiate level athlete, where this is our life and we're doing our rehab 7 days a week, hours at a time, most of us are, either not a professional, not a collegiate athlete, or getting back, or wanting just be an active individual who wants to get back to a sport or wants to just be an active lifestyle, right? We have a life. We may have a job. We may have a family. We may have kids. It depends on where you are throughout this recovery process, but it's very, very important that you stay consistent. Going to PT twice a week is not going to cut it. You need to be doing something for your knee daily. That doesn't mean hours at a time, but it could be, for example, some daily mobility work where you're just ranging the knee, getting your motion back, working on that flexibility. This could be 5 to 10, 15 minutes per day. And then on the strength side of things, it's not that you need to be strengthening 7 days a week. 3 days a week of strengthening can really move the needle where we need to go. But it's not about being sporadic, where we go very hard for a week or two and then we stop. is making sure that we're very consistent with our programming, that we have a solid schedule, a solid routine, and that we're following suit with the recovery process, because that makes a world of a difference. That consistency compounds, and that's what's going to bring your recovery to the next level. Number 4, big one for our workaholics here, is rest and recovery is just as important as working our butts off and staying consistent. So what I mean by strengthening 3 times a week, it's important to have those recovery days in between, because you're going to work really hard, you're going to push weight, and you're going to strengthen. You can't be strengthening on sore, tired, weak, or stiff muscles. Making sure that you go through your strengthening program and then take a day or two to recover, regroup, as well as again getting back to your strengthening program, because that makes a huge difference in how we progress over time, especially when we're looking at strength. Super important that not only you're working hard and you stay consistent with your programming, but as well as having those recovery and rest days in between, that you can actually rest those sore muscles, regroup, and then get back at it. The last step, or last big mistake, is using time as your guide for your recovery process. What do I mean by that? A lot of times after your surgery, you're going to be given a piece of paper, which is a protocol from the surgeon, that will have some examples. Week 1 to do these specific exercises, week 4 to do these specific exercises, week 8 or 12 or whatever. It's going to be in order, and it's going to be protocol. Now, the issue with this is everybody's going to respond to their surgery a little differently. Everybody is going to progress a little differently. So we cannot use time after surgery as to when we can get back to certain activities. So important that we guide this recovery process through physical milestones and not time after surgery. What do I mean by that? For example, it's very important during this process that we strength test you along the way. We may strength test you starting at 2-3 months, looking at the specific muscles that surround the knee, and importantly, the quadriceps, the hamstring muscles, the glutes. We want to assess strength. So we test your surgical side, we test your non-surgical side, and we compare those two. And then we also compare to your height and your body weight. So we want to make sure that your strength is not only side to side getting better, but also compared to your body weight. So when we understand, that you have strength there, well, that's when we'll tell you, okay, for example, you can start jogging, or you can start sprinting, or you can start some plyometrics, some jumping type activities. This is huge, because what happens is on a doctor's protocol, it may say week 12, start running, or start some hopping or jumping progressions. At week 12, we test your strength. And what if you have no quad strength there? What if it's very weak compared to the other side? Well, now you're putting so much pressure through your joint itself. And this is where people have problems. And then they start getting pain and swelling, and then issues start to happen, right? So that's why we don't use time after surgery. We use when you're physically ready. And that has to be objectively tested. And one important example of that is strength testing throughout the way. Usually here at the ACL Academy, we start strength testing at 2 to 3 month mark, and then we'll strength test every month thereafter. And we have certain cutoff scores where we will say, this is when you can start jogging. And then when you reach this cutoff score, this is when you can start some plyometrics or some agilities if you're getting back to a specific sport like that. So those are the big ones, right? Number 1, not rushing into surgery. Number 2, not finding an expert to guide your ACL recovery process, both a surgeon as well as a rehab specialist. Number 3, not being consistent with your recovery, right? Not having a schedule, not having a routine, not showing up to physical therapy, or not giving the care that the knee needs on a consistent basis. Number 4, neglecting rest and recovery, right? Just as important it is to be consistent, so important to make sure that you're giving your body enough rest and recovery in between your hard workout sessions. And the last one, and probably most important, is not using time after surgery for your progressions. Making sure that your recovery process is guided by physical milestones. Hope that makes sense, guys. If you have some questions, drop them below. If you found some value out of this video, please like it, please subscribe to our channel, and most importantly, share with a fellow ACLer that can benefit from these tips and educations. We drop a new video every Monday here on our YouTube channel.